Hello, everyone. Thank you for the opportunity to present to you today in this important session on links between the geo community and the current COVID-19 crisis. My name is Ben Zaitchik. I'm an associate professor at Johns Hopkins University. I'm going to be speaking to you briefly about some of the challenges and opportunities on linking geo observations of hydrometeorology to the current COVID pandemic. So, to begin with, I don't think anyone needs to be reminded of where we stand right now. This is live as of when I recorded this presentation, about a week before it will be provided to you. Looking at the global case number on the Johns Hopkins University dashboard, and we see that we are going through this extreme pandemic that is beginning to show signs of slowing in some places, at least for now, but is increasing in others. Now, looking at a map like this and seeing that it is everywhere in the world, one might ask, why do we even entertain the idea of hydrometeorological sensitivities when clearly this disease can survive from Sweden to India and from South Africa to Ghana? And so there are a few reasons why we might expect some kind of climatic sensitivity, as most of you have probably heard discussed, at least in the popular media, if not the research community. And that is simply because COVID-19 is a respiratory pathogen. And these kinds of respiratory pathogens are known very often, not always, but very often, to exhibit seasonality in temperate regions, which we believe is due to environmental factors, largely meteorologically driven. And here we see from a recent review article, not on COVID-19 specifically, but on these such pathogens, there are several reasons this might happen, having to do with both the outdoor environment, the indoor environment, direct impacts of hydrometeorology on the virus itself, as well as impacts of those hydrometeorological factors on the host. There is a good reason to believe that this matters from a process perspective. And we think we know something about what variables matter. Not so much for COVID-19, I'll come back to that. There's a lot of uncertainty, some claims out there, but certainly dominated by uncertainty right now. We know that for influenza, which we know best, as well as some other viruses, that there's a sensitivity that's been observed either empirically or through lab-based and other studies, that these viruses could be sensitive to temperature, to absolute and relative humidity, and to UV radiation, impacting, again, both the virus itself and the factors that lead to transmission. So these are kind of some leading candidates. And so coming to us as the geo community of practice, we really see that there are some great opportunities for us to contribute to understanding here. And why? Because we do this stuff well as a geo community. So just to give some examples, can we do UV at the surface? Yes, we can, through data sets such as the Tropomi surface UV index. Can we do temperature? Yes. So here's just an example of the CHERTS surface temperature project, a cloud-free composite produced by the Climate Hazard Center. And that's at 0.05 degrees resolution. And can we do specific humidity? Well, that's a little trickier for us. You know, our direct satellite observations aren't necessarily getting us to near surface specific humidity, but we can, through our data assimilation and reanalysis products, for example, here's the North American Land Data Assimilation System product for daily surface specific humidity, we can create satellite informed products that then can be used to draw time series. So here, for example, some work we're doing, time series for a county in the United States during the unfolding of the pandemic. So yes, we can get these variables. So it seems here that we've got a great opportunity. Where do we stand on actually providing some answers on the hydrometeorological sensitivities of COVID? And this is where the news gets a little less promising. Here, a student in my group has compiled, not complete by any sense, but representative of some studies that have looked at temperature sensitivities of COVID-19 transmission. And what you're seeing here are the bar charts are organized to show you the duration of the training data used to develop usually an empirically informed model, either of the transmission rate or of case count or some other relevant outcome. And if it's blue here, it means they found that as temperature increases, the susceptibility to the virus decreased, or the rate of transmission decreased. If it's red, the opposite is true. If it's gray, it was neutral and non-significant. So you see here, despite the fact that we've got some biophysical reasons to expect this kind of sensitivity, there's not a consensus yet. The answers are all over the map, and it depends on exactly which data went in, what they're trying to predict, as well as what the time period of data collection was. You can then look at humidity. It's even more uncertain. So first of all, some are looking at relative humidity, some specific humidity, looking at different data, different time periods, and really nothing that we can say with any certainty. Some ranges perhaps have been identified for optimal transmission, but not a statistically significant result that seems robust everywhere. One might say, well, that's because the globe is too complicated. Let's look at some place more specific. So here's just one example for China. And yes, now maybe the majority of the studies are showing a negative relationship with temperature, so maybe we're getting somewhere. But again, that's still far from comprehensive or a consensus result. Looking at humidity in China, a total mix. Okay, so here's a place where we had the earliest case records, and yet still uncertain on what humidity is doing. And so what's going on? Well, I think it's fairly obvious to us. One issue is we're dealing with an evolving pandemic. And so as an evolving pandemic, we can't expect to have stable case counts to work with. The dynamics are shifting as we study them. A second point that we have to take quite seriously is that there are other factors that are going on that are correlated in time. This is an epidemic that started in the mid-latitude northern hemisphere winter, and as we move into spring, showing here some analysis from Italy, similar results our group is going to be publishing soon for the United States, we see that as social distancing on the left side of your screen became more effective, so people became more socially distanced relative to baseline, we can then see a flattening of the case count curve. That's happening as it's getting warmer at the same time, as it's getting higher specific humidity levels. We need to be able to disentangle that, and that's very complicated to do. And then, perhaps most importantly, going back to this picture of the dashboard case count, our data on the cases are inconsistent and unreliable in many places. So we have different spatial resolution, different temporal coverage, changing case measurement frequency. Determining what the proper response variable is difficult. Is it the total case count? Is it the doubling rate? Is it excess deaths? All of this is moving as we move forward. So in some sense, the Earth observations very often are ready, but some of the complementary data are not quite ready. And so given this context, all right, where we've got a reasonable understanding of why we would expect to see sensitivity, albeit through pathways that are not to be determined, and where we have Earth observations that as a group on Earth observations we are ready to provide and developing all the time, what can we do to contribute usefully as the pandemic unfolds? And I'd argue there are a few things that we can do even in the context of this uncertainty. The first, as many are already working to do, certainly the National Oceanographic and Atmospheric Administration in the United States, as well as Copernicus in Europe, have been very good at trying to make data accessible. Usable, this means really finding out what formats are needed, at what scale and space and time are needed by our epidemiological colleagues, and also understood. Do we really know what's happening in these data? We need to make sure that others are able to interpret what we put out there. Second point is collaboration is key here. In this evolving literature, we see a number of examples where Earth observation specialists are working not in isolation, but perhaps without full engagement of disease experts. And so then you end up with some results that might be robust from the Earth observation perspective, but can be, honestly, sometimes misleading when we don't take proper account of the expertise on disease transmission. So that needs to be incorporated. And finally, I think communication with our community has been critical. GEO has been wonderful for this, to make sure that we are in touch with each other and also in good position to reach out beyond our community. We all need help doing that. And that we want to think creatively about Earth observations. I've only had time to talk about a few key variables, but there could be many more. And we want to think about how Earth observations could inform our understanding and the predictability of the pandemic. So with that, I will thank you for your attention and end.